Fetal monitoring. Today we're going to discuss what fetal monitoring is, the different kinds of fetal monitoring, and what you need to know about fetal monitoring before going in to have your baby. Also, I'm going to address an elephant in the room, which shows that what most people are doing actually maybe isn't the safest, so make sure that you're staying tuned. First off, when you're learning about fetal monitoring, you want to make sure that you're learning from an expert. I see a lot of doulas talking about fetal monitoring online, and while they may have a broad understanding of fetal monitoring, honestly, nurses are the queens of fetal monitoring. Even more than doctors, because nurses have to certify every couple years in fetal monitoring, learn about the new research, the new advances, and they are constantly doing it and reading it. So make sure that you're learning from an expert. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I swear 19 years of that was looking at fetal monitoring strips. It's just ingrained in my mind. So I'm excited that you're here. And really quick, monitoring is actually part of creating a birth plan, kind of understanding how you would like to use monitoring during your birth. I think it's a great thing for you and your partner to think about. Check out Birth Plans Made Easy. I'll put the link down below. Okay, so what is fetal monitoring? There are two parts to the fetal monitoring strip. And when you look at it, when you're in the room, you'll see a top one, and that's the baby's heart rate. And you'll see a bottom one, and that's contractions. And you usually know that you're having contractions by a little molehill. Now, I hear a lot of people saying, oh, your baby should be between X and Y number in the fetal monitoring world. I gotta say that it really depends. You got to trust the nurse to know the fetal monitoring. I know a lot of people are like, well, I want to learn about fetal monitoring, so if they're doing it wrong, I can help them. When in reality, it is so complicated to learn about fetal monitoring. I would really leave that to the experts. Get prepared for the rest of your birth and some of the basics in the online prenatal class for couples. But learning fetal monitoring is more than you really need to know before you go in to have your baby.
Okay, editor Hillary, as I was watching this, I wanted to give you guys kind of a better idea about what fetal monitoring looks like. This is from a conference I was at. It's not from a patient's chart. So this is what fetal monitoring will look like on the screen. A lot of places they print it out on paper, but not always. So this screen, the green one on the top, that's the fetal heart rate monitor. We want to see those small fluctuations like we're seeing, those little bumps. Those are good signs. So you want to see the fetal heart rate between 120 to 160. Small dips below that or small things above that are not a big deal. Again, this is what your nurse is trained in. Now, the purple line below that, that is contraction monitoring. You'll see the contractions are those molehills. Now, every one of those smaller boxes is 10 seconds. And it's kind of hard to tell on this picture, but I'm guessing those are actually 20 seconds. So it looks like her contractions are about a minute long and they're about 4 minutes apart. So that's what fetal monitoring is going to look like when you see it on the screen. And again, sometimes they print it out on paper as well.
Okay, so the baby's heart rate is monitored by ultrasound most often. There are a few other ways that we can measure it. We're going to talk more about wireless monitoring. Stay tuned. But there's also something called a fetal scalp electrode that just goes in the very top of the baby's head. We put this in if baby isn't showing as well on the monitor as we would like, or there's some issues and we're just not getting a clear enough strip for us to feel comfortable. Of course, that's always up to you, but that might be something that they encourage you to have put in. It does go into the very tip of the baby's scalp, and sometimes babies do get a little scab from having it put in. The second monitor is the contraction monitor called the TOCO. Tocodynamometer, I think is the long name, but everyone just calls it the TOCO. It's just a pressure monitor. So think of your kitchen scale and how if you push down on it, the number goes up. Same thing for the TOCO. It's just measuring pressure against the little bagel half. You can also measure contractions with a IUPC, intrauterine pressure catheter. It monitors right between the baby's head and the uterus, so it gets a very exact amount of how contractions are functioning in your uterus at the time. The TOCO actually is not a great indicator. A lot of times I'll see dads over there being like, oh, you got a good one. Oh, there's another good one. And the mom's barely feeling them. And it may just be how we have it placed, how baby's placed, how much fat you have on you. It really depends. You can't really tell how strong a contraction is with the TOCO. And again, both of those can actually be used with a wireless monitor. We're going to talk more about that. Stay tuned. There's another way that we can monitor you during your pregnancy, and it's called intermittent auscultation. I have a whole video about it that you guys should totally check out if it's something that you're interested in. The pro tips that you need to know is this is really only for very low risk pregnancies. So no induction, no epidural with intermittent auscultation. Sometimes in the very early stages of an induction, you could use intermittent auscultation, but once you get Pitocin person, intermittent auscultation is off the table. You do need continuous monitoring. How this one works is your provider listens with a Doppler, so the same thing that they listen in the doctor's office, before, during, and after a contraction. And it depends on where you are in labor, how frequently they do it. It varies between like every 5 minutes up to once an hour. I gotta say, there are a lot of hospitals out there that don't even have a policy for intermittent auscultation. This is different than intermittent monitoring, which is what a lot of hospitals boil it down to, which is just continuous monitoring for about 20 minutes out of every hour. Intermittent auscultation has to be done with a Doppler, and it usually takes 1-to-1 nurse ratios, which is why you'll see a lot of hospitals don't do it. It would be really difficult as a nurse to have 2 patients on intermittent auscultation unless they were only being watched every hour or so. And in fact, because we all use computer charting now, we didn't even have a spot to put intermittent auscultation. It would have literally been almost impossible for me to do. I guess I could have just written a nurse's note every time, but I don't know if we had a policy. Our hospital never did it. 2 out of the 3 hospitals I worked for didn't have a policy, never used it. But finally, in the studies, which I talk about in that full video, it talks about how it actually lowers C-section rates. There is a small increase in neonatal seizures, but it does lower interventions and C-section rates overall. So I think it's something that we should be considering. I know a lot of you come into labor and delivery and you want your baby monitored the entire time because it helps you feel better. I know a lot of people actually finally can breathe because they've been worried about their baby their whole pregnancy, and now suddenly they're on the monitor. They know that they're doing okay. But intermittent auscultation has a place because the longer we watch, the more things we do. If we watched any baby, their heart rate would go down at some point in time. If we watched you or me, we would have disconcerting heart rates at some point during the week. And so if we were in the hospital, we might do an intervention for that. Even if you don't need it, you're functioning just fine at home. Same thing goes for baby. We see things that happen, and sometimes we perform interventions that baby maybe does or does not need. Anyway, I think it's worth checking out if you plan on a very low risk delivery. However, if you're planning on an induction or an epidural, it is not going to work for you. Okay, this brings us to wireless monitors. Now, I gotta say that I started labor and delivery in 2001, and really very little has changed in fetal monitoring, at least the basics and the equipment that we use, since 2001. So when wireless monitors came on the scene, it was really nice to see. Now, there are 2 different kinds of wireless monitors. One of them still uses the little bagel halves, and it just hooks into a transmitter that I usually hang on an IV pole. So if you want to go walking, that's a great option. It uses telemetry wires throughout our unit to transmit that back to your fetal monitor, but you're still going to have the same circles on your belly that monitor the baby's heart rate and your contractions. But there's a new thing on the scene. It's called the Novii, also called the Monica. We called it the Monica where I worked, and it is a wireless transmitter. Think of Bluetooth headphones, other Bluetooth devices. That's how this one transmits. And it's just the one monitor on your belly that has these weird wires and this sticker that we put on. But just like any technology, it has problems. I hear so many people saying, oh, we have wireless monitors. I cannot tell you how frustrated nurses get with these monitors because they just are hard to troubleshoot constantly. They're frequently having problems. The machine sometimes won't pick it up, or sometimes it just like drops a couple minutes because it's not transmitting right. And so it can be really frustrating for the staff because they're not a magical cure for everything. And one of the things I really hate about them is that they seem to be even worse for the people that wired monitors are the least helpful for, which tends to be people who are overweight or just have a body size with a bigger belly. So I don't want you to think that wireless monitors are the end all be all, or if your hospital does not have wireless monitors, which is true for a lot of hospitals across the United States, they're very expensive, and the stickers we use are also very expensive. And so a lot of hospitals really can't afford them. So while I think it's amazing, this is technology that is evolving, although I gotta say they put out a new unit, I think last year, and people were saying they thought it was worse than the old unit. It is a tricky thing, and because there is so much litigation in labor and delivery, there really are only a couple of companies even dipping their toe into this thing. So hopefully with time, they will get better. Tell me down in the comments, are you planning on having fetal monitoring? Or if you've already had your baby, did you have fetal monitoring? Now, if you're sitting there thinking, Hillary, my hospital does not have wireless monitors, I am really frustrated and so sad, I am here to tell you that there is a lot you can do with wired monitors. Now, can you walk around the labor and delivery unit? Probably not, although I think most labor and delivery units have some telemetry monitors, which can allow you to walk. However, those wires are pretty long. I can tell you this from a person who's tripped on those wires so many times, especially when I was pregnant as a labor and delivery nurse. But the length of those wires allows us to do some awesome things, even while plugged in to the wired monitors. And by the way, if you're thinking, I just want to refuse all of this, I'm going to talk more about that, so stay tuned to the end. And while you're here, if you're liking all this information from an experienced labor and delivery nurse, please like this video. We're really trying to grow our channel, and it means so much. And subscribe so we can hang out for the rest of your pregnancy. I am shooting so many videos lately, I think you're really going to enjoy it. Okay, so what can you do with wired monitors? I know it seems so 1990s, but yes, wired monitors can be awesome, and they don't have as many problems as the wireless monitors. One of my favorite things to do is to sit patients on the doctor's stool next to the monitor. So you still have all of the space around the monitor that you can use. Sometimes that even gives you more space than even if you were in the bed, because the wires still have to stretch to the bed. I actually think that the doctor's stool is one of the least used tools in the labor and delivery room. I think some nurses are hesitant to use it because the doctor is going to sit on it, but I figure everything in that room is for you to use. So I'll put down a Chucks just in case your water breaks. Nobody wants to have to sit on that. And then you can sit on that doctor's stool and rotate and do everything that you do probably on a yoga ball, but with a little bit more stability because we have these nice hard floors. They roll, and so it makes it really nice to stretch out your hips. You can even do those sexy hip circles on the doctor's stool. I just love a doctor's stool. Of course, some labor and delivery units will have a yoga ball, and if you really enjoy the yoga ball, that can be great. I will say that sometimes we don't have the right size. Sometimes they're too small, or sometimes they're too large to where you really don't feel stable on them. This is why I like the doctor's stool, because it also can come up or go down. Doctor's stool, big fan. I love it to use these side rails on the labor and delivery bed to do squats and lunges by, because you can hold on to that almost like it's a ballet bar and really open up your pelvis in different and new ways. Of course, nobody wants to do hours of lunges. I can tell you this as someone who just did a YouTube video workout, but doing squats and lunges are some of my favorite things to do while you're in labor. Not only does it kind of help to stretch out those crazy hip flexors that can really tighten up while you're in labor, but can also open up your pelvis in new ways to help baby come down into the birth canal. As you can imagine, as you do lunges, it really just opens up this pelvis in new ways. I've actually had patients do lunges down the hallways and have had such good luck with it, but you can also do that at the bedside. You don't have to be walking away from the monitor to make it work. Another thing I love to recommend is dancing at the bedside. And you do not need to drop it like it's hot, just like some swaying. Do the old bear hug dance like you're in junior high with your partner. It just gets good feelings going, passes the time well, and I think it can be a fun way and can still be done with wireless monitors. Just be careful you don't trip on them like Hillary does. Now here's a quick caveat. Not all wireless or wired monitors are waterproof, although most facilities probably have waterproof monitors. So you'll want to check with your facility about ones that can go in the shower or the tub. Huge fan of the shower, by the way, probably more than the tub, just because getting out of a tub is tricky when you're 9 months pregnant. But talk with your unit. This is a great thing to ask on your upcoming hospital tour. And in fact, I have a whole podcast on making good use of your hospital tour, and I will put a link for that down in the show notes. Okay, can you refuse monitoring outright? On the social media, I have seen a couple of times where people are upset because nurses kept moving the monitors. I've even seen people who said that they hit their nurse because the nurse was adjusting the monitors during a contraction. So you have two choices. One, you can be monitored, or two, you can refuse monitoring. However, if you've asked us to monitor your baby, it is likely that we are going to have to adjust the monitor, and sometimes even during a contraction. As you can imagine, during a contraction, baby shifts down into the pelvis. And so if we only lightly have the baby on the monitor and then you contract, baby then goes off the monitor during a contraction. And a lot of times that's really when we need to see how baby is doing on the monitor. So I get it. It's totally annoying. As a nurse, it is totally annoying for us too. There are some patients that I am in that room every 5 minutes for an entire 12-hour shift because their baby just will not stay on the monitor. But as the patient, you kind of have to decide, do I want my baby to be monitored or do I not want my baby to be monitored? And if you're in a low risk situation, maybe intermittent auscultation would be a better option for you. Just as a reminder, if you have intermittent auscultation, though, it's not as easy to maybe sleep if your baby will stay on the monitor, because the nurse will come in at the interval designed to watch the baby, and she may need to wake you up in order to get access to your belly and all those different kinds of things. So can you refuse monitoring entirely at the hospital? Absolutely. You can refuse anything in the hospital, but I'm here to tell you that it is one of the big tools in our toolbox to monitor baby throughout delivery. And if you were to say, I do not want fetal monitoring, we would not be able to induce you, and we would not be able to run an epidural during your labor. As a nurse, there are certain requirements that I have to meet in order to run medications for an epidural or for an induction. So it's important to know that if you were to refuse fetal monitoring, you can't do any of the higher risk things. And I gotta say, in my 20 years of labor and delivery, I rarely saw people refuse monitoring. Some of them took it to intermittent monitoring, again, only for low risk patients. And in one of the hospitals where I worked, we did do some intermittent auscultation at those set intervals, so it makes it a little bit easier to relax when the nurse isn't doing direct monitoring. And if you're saying to yourself, Hillary, this is really complicated. How am I going to make choices for myself when I'm actually in labor? And I am here to tell you that you really need to take a birth class that helps you understand both the risks and the benefits and give you a basic, sure foundation of information to make those choices on. The online prenatal class for couples is just that type of class. It is going to give you the basics so that you understand common interventions, how to manage pain naturally, third trimester testing, which is a lot of times where things start to go on the rails. It is affordable, it is taught by an unbiased, educated expert, and it is meant to turn your partner into a teammate, not just a cheerleader. I'll put the link down below. And while we're here talking about the choices in labor, I actually have a whole video about the choices in labor that I think you guys will really enjoy. And I hope you guys will enjoy my other videos as well.